Early morning at King Faisal Hospital, Mukanyima Primitiva had just completed an MRI scan on her back. She's among many who are willing to donate their body organs after they die in order to save the lives of others. I accepted that I can donate my organs to the needy, just as I can also be given, because it's a kind act and sign of love. I don't mind that my organs were to be donated to others if I were to die. If it were determined that any of my organs can be useful, I would be willing to donate them, just that I could possibly need a transplant myself. Donating organs to save others is humane, so I would be willing to do it. Among the body organs that will be eligible for donation are kidneys, the liver, corneal tissue, bone marrow, and more.
The corneal tissue that will be donated will be from the deceased, and it will be extracted from a person when it is still useful. Therefore, we shall get time to sensitize people so that people who are willing can donate their organs after they pass away, and they can be of use in the lives of those who are still living. This will start next year, and we now have specialists for that, and we are working so that the conditions of the operating theatre meet international standards.
The development presents several benefits. Here is much cheaper, whatever the case. It's not the same as having patients traveling overseas. Even if the costs were to increase here over time, it would still not be the same as paying for flights for a patient, caretaker, and the donor. The specialist in forensic medicine, Dr. Mushumba Herbert, explains the significance of using organs for the deceased in medical research.
For example, what we are experiencing at the moment, the COVID-19 pandemic, the early research that explained or that shed light on the actual manifestations and the actual damage that the virus causes to the different body organs was established through such initiatives like studying organs, studying tissues from deceased persons. So there is indeed a demand, and there is indeed an opportunity for us to conduct research, like I just mentioned, be it for the medical practitioners, be it for scientists, and also for medical students.
The Director General for Clinic Services in the Ministry of Health, Dr. Nihabose Colonel, explains how the law governs such procedures.
There is a consent form. Someone must consent either for medical purpose, for medical purpose, for organ being donated, benefiting from someone who is sick, and also consent form someone who can donate his body or his tissues for researches in medical universities. So there is a consent form, and we have some guidelines and some forms of consent form which will be filled by someone who can be willing to donate himself for various reasons I mentioned earlier.
The law governing the transplants of organs was published in the official gazette back in April 2012, and it is currently undergoing amendments to reduce the legal age limit of donors from 21 to 18, as well as to establish who is to incur the cost of the operation to extract the organs. Betty Mutoni, reporting for RwandaTV News.